The easiest way, or the best way, to prevent osteoporosis is to make sure you're taking good care of your bones during the bone building years. So, the bone building years are in adolescence and in young adulthood. That's when we put most of the calcium, and that's when we reach peak bone mass in our late 20s, and then we start to lose bone from there on out. The best thing that we can do to prevent osteoporosis later in life is to take really good care of our bones now, make sure, or in our younger years, right, when we can pack on that extra calcium, vitamin D, make sure we're doing keeping good weight control, make sure we're doing good weight-bearing exercises that isn't wearing out joints to cause osteoarthritis, but also causes enough to ensure that bones stay nice and strong and are able to keep up. Once this disease takes hold, the best forms of treatment will involve regular weight-bearing exercise. So physicians may encourage patients to take on exercises that may include weights, may try and strengthen those bones. The more impact that is put on bones that are porous, the more they will grow, the more they will need to hold on to that calcium to grow, and it will make those bones stronger. It will have to be a regimented exercise program with that is designed by a physician to make sure that a patient isn't put at risk for increased falls, but they will want to make sure that they're putting weight on those bones to make sure that they're being built. If they're going to talk about prescribing something, they want to make sure that alendronate may be a prescription medication. I don't mean to say they would. It would be a definite thing. This is up to the physician, but depending on the patient, alendronate is a common supplement to make sure that the bones are being built up. The brand name of this is called Fosamax. So brand name Fosamax is the same as alendronate generic. Also to make sure that they're getting plenty of fruits and vegetables and all sorts of complementary nutrients, vitamins, making sure they're getting plenty of vitamin D, vitamin C to help build those bones up strong. Concept applied. Make sure that we're taking good care of our patients, especially if they've had recent fractures, taking very, very good care of them as far as making sure they get prompt imaging, nice, good service, good patient-centered care. But most of these patients won't, right? Most of these patients that you'll find day to day that have osteoporosis, we just need to make sure that they're up to date on their DEXA scans. We can ask questions about if they're exercising regularly, and we can make sure they get their refills on their supplements or any other medications they need. Ask about smoking status and anything, and because it's such a risk factor, make sure that we're verbally reporting any kind of changes, especially if they've started smoking, to the physician.